that was given $109 million recently to a doctor that was declared to have practiced in a malpractice way. Well, he perhaps deserved it. I don't know anything at all about it. But on the other hand, it also ruined his life and his family and everything else too. I just think there's a lot of things we can do before we just, just do a complete about-face.
Now, we're almost out of time, but, as a psychologist, one thing that I do is I look at how people look at reality. That Aristotle once said that it's not reality that bothers us, it's how we look at reality. And so, is there an optimism that's still there? Does this panel feel like there's hope that we're going to get through this? So I think just to, we've kind of started this, we will continue this in another series, but is there hope? Final comments. Don?
Absolutely there's hope, and Reverend Dotz brought it up, I borrowed the microphone. There is hope, because let's go back to Scripture. What did Christ tell us? He said, we're our brother's keeper. We should take care of our families, we should take care of our parents. Honor thy mother and thy father. He didn't say, Caesar should take care of your parents or the poor. He said, you should take care of the poor. And people have turned over their responsibility to the federal government, which has usurped it. This health care problem before us now, this reform, has nothing to do with taking care of patients. It doesn't address the poor people. If we want to take care of the poor people, there's really only about 5 to 8 million people who can't get insurance. Most of the rest of those people are either transitioning between jobs for 4 months or less and go bare. They're young and they don't need it, or they're aliens, legal or illegal aliens, and they can't buy insurance or don't buy insurance. And even those people should be taken care of. But we've taken the personal responsibility away from the people. We've given it to the government, and we've put roadblocks in and punishments that if the people want to do something. The Founding Fathers were very wise. They did not put the words health care in the Constitution. We don't find that anywhere. The federal government has messed up welfare, it's messed up education, and it's messed up the welfare, health care, and the educational system.
And so you feel like, though, we can
get back to personal responsibility. This is why you, sir, were able to take care of patients for $3 a day. It was you and the patient. And the patient made a financial decision when they went in. We've been so generous politically with our health care that the poor person can have a headache for 2 weeks, call up an ambulance, spend $400 to go to the hospital with the ambulance, end up with a $5,000 workup because the doctor there doesn't know what's going on, rather than going to the clinic and spending $20. People don't have any limitations on themselves with a prepaid system. We need to get back to personal responsibility, whether it be the wealthy person, the common person, the poor person. We get back to personal responsibility and everybody have a stake in it. And there's great ways we can do it. With health care funds, real insurance, not prepaid health care, real insurance for catastrophic events, and taking care of the poor people. And the poor people should be taken care of back in the county level and at the state level, because the federal government has no heart. That's why Christ never said, let Caesar do it for you.
Delwin, you got some hope? You got some optimism?
But I'm also thinking backwards here. Bob, you remember our first stimulus money?
Yes.
Of the 30s was called WPA.
Yes.
But at least they didn't just hand the money out. Somebody had to have a shovel and help build a road to get $1 per day. And the idea was that if there was some money put out here, it would stimulate the economy. I can remember the Franklin Roosevelt radio programs. We have nothing to fear except fear itself. And he was a motivator. And he had some good ideas, but then the political aspects of it saw that if you could start giving something to people, you could get votes. And then we started the great federal giveaways. And every one of them was aimed at not at trying to benefit society so much as it was the political aspect that we were developing in society.
But you've got hope that we can get back on track.
And I'm hoping. I hear some interesting things just this morning at the airport. The lady at the inside counter where you board brought it up herself. And I didn't bring up health care, she brought it up. She says, you know, I'm sick and tired of all this health care. I pay for my insurance because that's part of my responsibility. And I don't think I ought to have to buy insurance for everybody that won't even face up their own responsibility to take care of their own health. Now, there's a working person level. She's not an executive with Southwest Airlines. But I think there are a lot of our people seeing this thing in a totally different perspective finally. And hopefully there is some hope that it will get cured out. It's not going to be erased, but some changes will be beneficial.
Dr. Scioli, are you hopeful?
Well, I have to be at least hopeful, but I must say that I'm jaundiced to what our politicians are doing at this very time. I'm very disappointed. It's never the wrong time to do the right thing. Why can't they do the right thing? And it is a political ideology issue right now. These people are pandering for position, for votes, for voting blocks of people, and they're getting away from the real issues at hand. So I am hopeful that as these bills are moving forward in Congress, that the conference committees will allow reasonable amendments and let common sense come back into the equation. Americans are always good at common sense, but we've got to be loud with our voices to tell our politicians.
Okay. Reverend Dotz, you optimistic?
Well, I'm very hopeful. I'm a religious person, and I think physicians, nurses, other medical people, admit it or not, know it or not, are called by God. And that calling will reach deep into their lives and make differences. So I'm hopeful. It isn't like they just decide to do this. They're called to it. Secondly, for the last 2 years, I've been meeting every Sunday evening with students doing their PhDs at Tech. And a recurring theme is that they will tell me, if they're from Uzbekistan or Saudi Arabia or Denmark, they will tell me, you live in a paradise here. Comparatively speaking, this is a paradise. And I think I boil it down, we have a constitution. And however poor we may be, it's an ought. And as long as we're struggling for it, I think we are a paradise. So I've got a lot of hope.
Good. Isabelle?
Brian, you mean the Texas Tech students. At one point, I used to have some TV appliance rental stores. And one of the big things for Texas Tech was these little dormitory refrigerators. And somebody said you ought to get some of those and rent them to tech students. And we very dumbly bought a bunch of them, put an ad in the paper, you know, before school started in the first week. And people came in and we just let them have a refrigerator and they signed their name, told us some address for Texas Tech. And suddenly they were all gone. And I told one of the guys working there, I said, you know, we just let them walk out with all of the refrigerators and we don't know anything about it. We just lost one refrigerator out of that whole bunch. All the rest of them, when the rent was completed, brought it back.
Okay. Very
That was
good.
inspirational.
Very quickly, Isabelle, you got hope?
Sure. I mean, that's what we live on. And I hope that out of all of this, we begin to see that through our educational system, we need to start, and through our parents, we need to start instilling responsibility for oneself and stop relying on other people being responsible for us. We give up a lot when we do that.
Well, we've got to cut it there. We're down to our last few seconds. Hope you'll check in on the other ones that we do on this series. Again, I'm Dr. Brian Carr, and this is a Lubbock Roundtable. I want to thank the panel. Y'all have been really great here, and I appreciate your coming in. And we'll be having some future ones. Get the word out, and let's get some more people listening to this, and take care, and get back to some personal responsibility. So thank you, and have a good day.